And on that front, also say passive vaccination. If you have that individual and you're not certain, you're not confident that those vaccines are providing that protection, we have Evusheld. And so I think people need to go to covid.gov and they need to find where they have access to this. I really think we're underutilizing it. I feel like, well, I felt like I was doing a good job. And then I just had a patient today, actually late yesterday, who tested positive for COVID. And I was, realizing I probably should have considered them for Evusheld. So this is out there. It's sitting on shelves. Let's make sure we consider that. And this will bring me back to Biden. So the period of detectable viral replication. So you've done everything. You've gotten vaccinated. You're trying to be careful, but now you get a positive COVID test. I like to say the time for monitoring, monoclonals, antivirals, perhaps enrollment in clinical trials. You don't start those steroids in that first week. You don't put them on zinc. You don't put them on antibiotics, no doxycycline, no azithromycin, no aspirin. These things are not helpful. But what can we do? So again, these therapeutics are sitting on shelves. There's no shortage. They're actually incredibly well tolerated. I'm going to tell you a story that disturbed me. I try not to get upset. I try to stand back emotionally, but I got a call yesterday from one of the hospital-based physicians that I know, and a family member of theirs, a relative, who has high-risk conditions, but is a student at an Ivy League university in our general area. I won't mention the place, but they went to student health with an acute COVID infection. They were feeling crummy. They tested positive just the first day or two of symptoms, and they asked, "Are you ready for this?" They asked, "What about Paxlovid? Would I be a candidate for Paxlovid?" And the practitioner at this prestigious university said, "Yeah, I don't really prescribe that. I'm not sure how comfortable I am using it. Why don't you reach out to your endocrinologist, see if you can schedule a telehealth visit, and maybe they can see if that's right for you." Well,
I've heard that. I've heard that. Here's another one. One of our listeners wrote that she's at risk. So she said to her doctor, if I get infected, could I get Paxlovid? And he said, what's that?
ouch, ouch, yeah. So, number one, right? What is the number one thing we recommend? It's Paxlovid. And there's only a couple things you need to know. So one is, are they high risk, right? All these therapeutics, and I know everyone's not happy about that, but at this point, they're reserved for high risk individuals. Is this person high risk? So in this case, yes, the person was high risk. Second is, what medicines are they on? Are there any interactions, that we have to worry about that would prevent us from using Paxlovid? Number three, what is their kidney function? And number three, I want to just sort of add something because we had this done recently. We had a patient, they were started on Paxlovid. The basic metabolic panel was sent off. We then adjusted it the next day for renal function. So not a big deal to get that first dose in while you're waiting for those labs to come back. So Paxlovid, and incredibly well tolerated. I actually have to say, from personal experience, patients are telling me almost the same as the monoclonal experience. Boy, within 48 hours, I felt so much better. So people really feel better. These are incredibly well tolerated. There's lots of supplies out there. If your doctor's not aware of it, well, get a new doctor. Sorry to say that. But you can go to covid.gov and you can actually look in your area code. I had a physician the other day, and his comment was, oh, Paxlovid, I hear that's really hard to get. And I showed him on the locator that within a 5-mile radius, right, there were thousands of doses. So these are out there. So Paxlovid is the number one recommended. That's about a 90% reduction in progression. So let's think about this. You're high risk. Let's say you're high risk with a 20% chance of severe disease. Now you've got your 3 mRNA shots, so about a 90% reduction. Now you're down to about 2%. You get put on Paxlovid at the appropriate time. Now you're down to a 0.2% chance of ending up in hospital. So we're really making some progress here. If you can't do Paxlovid for some reason, we have bebtelovimab. If we're going to use monoclonals, let's use an effective one. A little bit concerned that it took the FDA pulling an ineffective one away because people were still using it. We need to be up to speed and use what works. Physicians should be knowing this. Remdesivir is the other choice in that first 5 days. That's the 3-day outpatient therapy. And we also have molnupiravir. That's about a 30% reduction, so not as impressive as the others, but no drug-drug interactions, no renal adjusting. You just need to be careful around women of childbearing age, children. So get that pregnancy test. Make sure you have that issue covered as well. And go to covid.gov because these therapies are out there.